There's a secret pain that millions of us share, but almost no one talks about. It's a discomfort that can start as a minor worry, an itch, a strange feeling of pressure. Then, one day, you see a spot of bright red on the toilet paper, and your heart sinks. Your mind races through a dozen terrifying possibilities, but the embarrassment, the shame, it keeps you from whispering a word of it to anyone. Not your spouse, not your children, not even your doctor. What if I told you that this condition will affect more than half of all people over the age of 50? That at this very moment, an estimated 1 in 20 Americans is dealing with it? We're talking about hemorrhoids. And I'm here today, as a physician with over a decade of experience in this field, to tell you that the biggest problem with hemorrhoids isn't the condition itself. It's the silence and the fear that surround it. Today, we're going to break that silence together. We will replace fear with facts and shame with empowerment. So, stay with me. This is the conversation you've been waiting to have. Welcome. I'm Dr. Sarah Collins. First, let's get one major misconception out of the way. You don't get hemorrhoids, you have them. All of us do. What we call hemorrhoids are actually normal anatomical structures, often called anal cushions. Think of them as small, spongy pads of blood vessels and tissue, located at the very end of your rectum. These cushions work with your sphincter muscles to help you maintain continence. They help ensure that only gas passes when you want it to. The problem arises when these cushions become swollen, stretched, and irritated. That's when we say someone is having hemorrhoids or piles. It's this swelling, caused by increased pressure, that leads to all the symptoms we associate with the condition. It's important to know what kind of hemorrhoid you might be dealing with, because the type determines the symptoms. There are two main categories. 1. Internal hemorrhoids. These form inside your rectum. Because this area has very few pain-sensing nerves, you often can't feel them. The number one sign? Painless, bright red bleeding during or after a bowel movement. You might see it on the toilet paper or in the toilet bowl. It's alarming, but it's a classic symptom. 2. External hemorrhoids. These form under the skin around the outside of the anus. This area is full of nerves, so these hemorrhoids can be quite symptomatic. You might experience itching and irritation, aching or pain, especially when sitting, a soft, palpable lump near the anus. Sometimes, a blood clot can form inside an external hemorrhoid. This is called a thrombosed hemorrhoid. It happens suddenly and can cause a hard, swollen, and intensely painful lump that may look bluish or purple. This often sends people to the doctor, and rightfully so. There's also a grading system for internal hemorrhoids, which describes how much they protrude or prolapse. Grade 1. They are slightly enlarged but don't come out. Grade 2. They bulge out during a bowel movement but go back in on their own. Grade 3. They bulge out and you have to push them back in yourself. Grade 4. They are always outside and can't be pushed back in. Understanding this helps you and your doctor decide on the best course of action. So, what causes that pressure that leads to swollen hemorrhoids? It's often a combination of factors, many of which become more common as we age. Straining on the toilet. This is the biggest culprit. Pushing hard to pass a bowel movement dramatically increases pressure on those anal cushions. Chronic constipation or diarrhea. Both extremes are problematic. Constipation leads to straining with hard stools, while frequent diarrhea can also be irritating and increase pressure. Prolonged sitting, especially on the toilet. Spending more than a few minutes sitting on the toilet allows blood to pool in the anal cushions, encouraging them to swell. Aging. As we get older, the supportive connective tissues in our rectum and anus can weaken, making hemorrhoids more likely to bulge. Heavy lifting. Straining to lift heavy objects, whether at the gym or in the garden, creates a similar intra-abdominal pressure as straining on the toilet. Pregnancy and childbirth. The weight of the baby and the hormonal changes of pregnancy increase pressure on pelvic veins. Childbirth itself involves intense pushing. Obesity. Excess body weight puts constant, increased pressure on the entire pelvic region. You can see how interconnected these are. A low-fiber diet leads to constipation, which leads to straining and prolonged sitting on the toilet, a perfect storm for hemorrhoid trouble. The good news is that for many people, especially with grade 1 or 2 hemorrhoids, significant relief can be found with simple lifestyle changes. Think of this as your first aid kit for hemorrhoid care. 1. Embrace fiber. Fiber softens your stool and makes it easier to pass, reducing the need to strain. Aim for 25 to 38 grams per day. Add more fruits, vegetables, and whole grains to your diet. If you struggle to get enough from food, a psyllium husk or methylcellulose supplement can be a game changer. 2. Hydrate, hydrate, hydrate. Fiber needs water to work. Without enough fluids, fiber can actually make constipation worse. Drink plenty of water throughout the day. 3. Rethink your toilet habits. This is crucial. When you feel the urge to go, go. Don't hold it in, as that can make your stool harder. Do not linger on the toilet. No reading, no scrolling on your phone. Get in, do your business, and get out. Avoid aggressive wiping. Pat gently with soft, unscented toilet paper, or better yet, use flushable wet wipes or a bidet. 4. Soothe with a sitz bath. This is a classic for a reason. Sit in a few inches of plain warm water for 10 to 15 minutes, 2 to 3 times a day, especially after bowel movements. It's incredibly soothing for irritation and pain and helps relax the anal sphincter muscle. 5. Over-the-counter relief. Creams or suppositories containing hydrocortisone can help with itching and swelling, while witch hazel pads can also provide temporary relief. Use them as directed and for a limited time. Often, these steps alone can resolve symptoms within about a week. This is the most important part of our conversation today. While most hemorrhoids are not dangerous, you must never assume that rectal bleeding is just a hemorrhoid. Other, more serious conditions, including anal fissures, inflammatory bowel disease, and most importantly, colorectal cancer, can also cause bleeding. Diagnosing this yourself is a risk you should not take. Please, make an appointment with your healthcare provider if you experience rectal bleeding for the first time. Your symptoms don't improve after a week of home care. You have severe or worsening pain. The lump is hard and can't be pushed back in. You experience rectal bleeding accompanied by dizziness, lightheadedness, or fainting. Your doctor will perform a respectful and professional exam. They may do a simple visual inspection, a digital rectal exam, or use a small lighted scope called an anoscope to look inside. It may feel embarrassing, but for us, it's a routine and vital part of ensuring your health. If home care isn't enough, we have a range of highly effective, minimally invasive treatments. For internal hemorrhoids, some of the most common office-based procedures include rubber band ligation. This is the most popular treatment for grades 1 to 3. A doctor places a tiny rubber band around the base of the hemorrhoid, cutting off its blood supply. It will wither and fall off in a few days. Sclerotherapy. A chemical solution is injected into the hemorrhoid tissue, causing it to shrink. Infrared coagulation. A device uses a beam of infrared light to generate heat, which cuts off the blood flow and causes the hemorrhoid to shrivel. For very large, persistent, or severe grade 3 and 4 hemorrhoids, surgery might be the best option. A hemorrhoidectomy, the surgical removal of the hemorrhoid, is the most effective and permanent solution, though it does have a more significant recovery period. The journey of dealing with hemorrhoids is so often a silent one, walked alone in discomfort and worry. But it doesn't have to be. This is a normal part of the human experience. It is not a reflection of your hygiene or your worth. It is a medical condition, a very common one, and a very treatable one. You have the power to make changes at home that can bring profound relief. And you have the right to seek professional, compassionate medical care without shame. Taking that step to see a doctor isn't a sign of failure. It's a sign of strength and self-respect. I hope this conversation has illuminated the path forward for you. You are not alone in this. If this video has helped you, please consider sharing it with someone you know who might be suffering in silence. Let's continue to break this taboo together. Leave a comment below if you feel comfortable. Your story might be the one that gives someone else the courage to seek help. Thank you for taking this time for your health. Be well.